Okay, so I think we'll begin. Thank you so much, everyone, for joining us today. My name is Amy Sam. I am the Health Education Project Specialist at the Maxwell and Eleanor Blum Patient and Family Learning Center at Mass General Hospital. Before we get started, just wanted to go over a few items with you all. Please note that today's program is being recorded for educational purposes. If you're interested in viewing the recording, feel free to visit our Blum Center website at massgeneral.org/Blum-Center. Please note that everyone is in listen-only mode. Everyone has been muted so that we can hear our guest speakers today. If you have a question for our guest speakers, you may enter them in the chat box, which is located at the bottom of your screen. We'll have time for them in the end. Only Blum Center staff and the guest speakers will see your questions. Please do not ask any personal medical questions or information in the chat box. If you have a personal medical question, please ask your doctor. Okay, if you'd like to pull your screen, your slides. So next, I would like to introduce you all to our guest speakers. We have Abhi Mehta. Abhi is a recent graduate and registered pharmacist at Mass General. She is APHA certified in medication therapy management and serves as the pharmacist coordinator for the bedside delivery program for inpatients who need their medications before leaving the hospital. Prior to working at Mass General, Abhi was an adjunct faculty member at Massachusetts College of Pharmacy and Health Sciences. She is passionate about patient advocacy and leadership in pharmacy. Joining us today, we also have Petrece Palmese. Petrece is a registered pharmacist with over 30 years of experience. She was formerly an area healthcare supervisor in pharmacy operations at Walgreens before joining the outpatient pharmacy team at Mass General. She continues to drive clinical excellence in pharmacy quality outcomes. In addition, she is a co-chair of the MGH Pharmacy Equity Inclusion Committee. Abhi and Petrece join us today to give us a presentation on medication safety. So please join us in welcoming Abhi and Petrece.
Thanks, Amy. Welcome, everyone. Welcome to our presentation on medication safety. And thanks again, Amy, for our introductions. So I'm Abhi. I'm one of the pharmacists. I've been a pharmacist at MGH for about 2 years now, and I'm very excited to talk to you about medication safety and various tools pertaining to the same. Joining me today is also Petrece.
Hello, everyone. I'm Petrece, and it's a pleasure to be here with all of you. First, I would really like to thank Amy Sam, our Health Education Project Specialist, for the opportunity to present to you today. We welcome a robust dialogue, hear your ideas, your feedback and questions that you may have for us. Ultimately, our goal is to ensure that our patients, our caregivers, feel cared for, valued, and safe. Please enjoy the presentation.
Just before we get into the presentation, I wanted to let you know that the video in this conference room focuses and zooms out on its own. And so you might see us being in focus and being away. Just please kind of ignore that.
It's not your computer.
Okay, so now that you know a little bit about us, we would like to know about you. So using the chat function, for the next few slides, please put in the letter that represents you the most, and we'll talk more about some statistics pertaining to medication safety. So tell us what age group represents you. All right. Seeing a few Ds, some C's. Give it a few more seconds. Okay, so we have a lot of C's and D's. So welcome again. And we're hopeful that this presentation provides some insights that are useful to you. Okay. Next question. On average, how many medications, including prescription, over-the-counter, and supplements, do you take each day? Oops, sorry. There we go. So most of you are saying what B between 1 and 3, and that is consistent with the statistics that we have. So about 80% of American adults take at least one medication, and about 30% take 5 or more. This right here puts our presentation into perspective, because just because of the number of medications we're taking, it becomes important to make sure we're taking it safely and are reducing any errors associated with it. Next question. How confident are you about your knowledge regarding the medication name, side effects related to all your medications? A lot of B's, which is great. You know why you're taking them. And I see a few C's. So you have little information here and there. And that's great. That's really good to know, because we hope to bridge that gap. And by the end of the presentation, hopefully you'll feel a lot more confident about your medications. Have you or someone you know encountered any medication-related errors? So that's the results that we have are a mix of yes and no, and that's also really good to know, because medication errors are errors that can happen anytime between the prescriber writing a medication for you and you taking your medication. And about 1 in 5 of those errors occurs at home. The good news, though, is that most of these are avoidable. Are you aware of the most appropriate method to dispose of your medications? I see more no's than yes. And that again gives us an opportunity to bridge that gap. And we'll spend a little bit of time talking about safe disposal of medications. And 2/3 of adults do not know what to do with unused prescription medications, which is alarming, because it's one of the most common ways in which medication errors occur, by the medications being handed in the wrong, going to the wrong person. How often have you requested your pharmacist to counsel you on your medications? Good. I see a lot of B's and C's and a few A's, which makes us happy. And on a personal note, we love questions. We love when you come and talk to us. And studies have shown that medication adherence has increased and errors have reduced when patients talk to their pharmacist when starting a new medication. And this is a simple step you can take the next time you're at the pharmacy. Just go talk to your pharmacist and see what they have to tell you about your medications.
So let's talk about the why. As you can see, you're the patient. Safety comes first. You're in the driver's seat, and how you express yourself truly matters. Individuals living with or without chronic disease use metaphors to help describe the reality of their day-to-day experience when using their medications. Think about it. Here's a few examples that we hear. I have a sour stomach. I'm suffering with pins and needles. I have a thunderbolt headache. When using these type of metaphors, providers and pharmacists need to open their ears and truly listen to the hidden messages that you're telling us. This can be a helpful strategy to dig deeper, ask more open-ended questions, and have a meaningful conversation with your health providers about your medication experience. We extend ourselves to inquire to know more about the experiences that you're having regarding your medication intake or multiple medication use. This will lead only to new possibilities for all of us to create and influence strategies for safer medication use. Remember, you're in the driver's seat. 5 moments for medication safety. Starts with starting a medication, taking my medication, adding a medication, reviewing my medication, and stopping a medication. In the next series of these 5 slides, they include critical questions. Some are self-reflective for you, and some require support from your healthcare professional to work with you. This is a tool to promote patient, provider, and pharmacist interaction. 5 moments of medication safety is a way to encourage your curiosity about what you're taking and empower you to communicate openly about your medications. So when we're starting a medication, here's a list of questions. I'd like you to review them, and always remember that you're embarking upon something that is about to activate and engage your body on a whole new journey. Your goal is a need to know everything about your medication that you're taking. So when we get started, by asking these questions, you're setting a strong foundation of how you care about yourself and also the loved ones that you may be taking care of. So questions to ask: what is the name of the medication? What is it used for? Many medications have 2 different names: brand name and a chemical name, also known as a generic. It's good to know the side effects of your medication. Your provider and your pharmacist, again, as Abhi mentioned earlier, are here to help. Do I have other options in treating my condition? Yes, there are several other options. Medication, specialty compounding, could be a holistic, homeopathic therapy as well. Have I reviewed with my health professional team the allergies and health-related issues? You know, sometimes we forget about the allergies or other health-related issues, such as maybe eye and ear care. So it's really important for your physicians and your pharmacists to know this. Where should my medication be stored? In the refrigerator, freezer? How many days should it be out? Is it a 28-day, 56 days? Where should they be stored? It's important to ask these questions by starting off on a strong foundation. Taking your medication as prescribed, or also known as medication adherence, is important for your overall long-term health and well-being. Your pharmacist is an expert provider in how best for you to take your medication conventionally, or as I mentioned earlier, could be compounds. Something to consider. There's always options when taking your medication. You notice one of the questions up there says, should I take it with food? What happens if I like to have a drink? And what does salad dressing or shaving cream have to do with any of this? Well, in some medications, you can have alcohol. And in those hidden over-the-counter products, and also in certain foods and salad dressings, there's vinegars, could be an alcohol component that can affect you based on the medication that you're taking. So again, it's those little hidden details that it's always good to ask your pharmacist about. Go to the next one. Adding a medication. This is important. So, do I really need to take another medication? Does my health professional really know about all my medications I'm taking? Sometimes they do, sometimes they don't. It's based on what we do and how we communicate. Can this new medication interact with my other medications that I'm currently on? These are all very important questions to ask us and your provider. What should I do if I suspect an interaction? Call your pharmacist. We are the ones that will direct you on who you should see, and if you do need to go to an emergency room. Will I be able to manage multiple medications correctly? Yes, with the aid of your pharmacist. And that's something that we'll discuss later on in one of the slides. So it's important to know how best to add your medication into your medical therapy. Reviewing your medication. Every time you meet with your provider and our pharmacist, it's good practice to review. There's nothing wrong with bringing a brown bag of medication into your provider or your pharmacist to take a look over. We're going to discuss that a little bit later in regards to planning. But what we advocate is every 3 to 6 months, it's good practice to review your medication, bring it into us, because you might be doubling up on the same medication and not even realize it. You know, sometimes we ask ourselves, well, my health professional, he or she knows the medication that I'm taking regularly. Again, they may not. We can't assume. So it's always good practice for all of us to be on the same page when we're reviewing our medication. Stopping a medication. The only time that I would, and we would also advise, stopping a medication suddenly is when your pharmacist or your health provider is telling you to do so. Sometimes if we stop a medication suddenly, it can cause a lot of issues. So it's best to talk to your pharmacist and provider to make a plan of when to start to stop. Your provider can create a tapering plan for you to come off one medication at a time. And also, we don't think about this that often. We need to give our body time to go through the transition of eliminating the drug. Many drugs, because it is a chemical, it's metabolized in different areas of your body. So with that said, some may take a few days to be eliminated to flush out, and others may take up to 6 to 8 weeks. So it's important to know when to stop a medication. I will say, if you're having an adverse reaction or any type of anaphylactic reaction, then yes, we know to stop that abruptly and then seek emergency assistance immediately. But again, you want to have a plan to start to stop. And it's also good practice to tell your loved ones around you and even your pharmacist when you are stopping a medication. There are certain side effects that you may experience, and it's good for everybody to know because you might be going through a withdrawal, and sometimes people's moods change. So again, have a plan in place. So you can find all of this if you'd like. It's called the 5 Moments for Medication Safety Tips, and it's provided by the World Health Organization for your review, and also to review it with your pharmacist and your healthcare provider. It's a really nice tool to help protect you and your family.
So segueing into the next section for today's talk, I want to spend the next few slides talking about the safe disposal of medications and sharps. To begin with, we'll watch this 2-minute video by the FDA that details on how you can dispose of medications safely. Sorry, I have a question in the chat box that says no sound. We are able to hear it on our end. I'm not sure how we can make it audible to all of you. Let me pull it up on the website itself. Let us know if it's audible. Looks like it's still not audible. So maybe we'll play the video and then I'll explain it as we go along. Is that okay?
Would you like to give? Would you like me to give it a try? See
Yeah,
if I
sure.
can try to pull up on my end.
Sure, if that works.
Okay, let me see.
Sorry about that, everyone.
Can you see this okay?
Yeah.
Okay. Let me know if you can hear it.
No.
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 Sorry about that.
I'll just walk through it as we go along the video. Okay, so I'll just rewind it a little bit. So the video tells us that unused medications can be very harmful. And then it goes into talking about how we can dispose them. This practice just helps keep your family safe by making sure it doesn't get into the hands of someone who's not supposed to be on it. The most preferred way of discarding a medication is by drug take-back programs. Most pharmacies have such a program in place, and you can take your unused medications to a pharmacy or a police station and discard them. There are websites that will help you find these kiosks or locations. And I have a link at the end of this segment, but I'll show you how to do that. If you're unable to go to a kiosk, some medications can be flushed down the toilet. The US FDA has a list of these medications, and only the medications listed on this list can be discarded by flushing them. I again have a link for this. I have a link for this list at the end of the segment. So as you can see in the video, if you see the name of the medication on that list, you can flush it down. If not, you can throw the medications in your household trash, but there's a specific way to do so. The most recommended method is to discard these medications first in a bag containing ground coffee beans or other trash. and then throwing this bag into your trash. This way, your pets are unable to get into the medication directly. If you do throw something out, it's always good practice to blank out the name of the medication and your personal information. I hope that was helpful. All right. The next section quickly I want to talk about is disposing sharps and needles. Most drug take-back programs will not accept sharps and needles. And the way you can discard them is by purchasing sharps containers. There's different sizes that you can get. There's big ones for the house, and there's small ones that you can use when you're traveling. Once they are full, you can find drop boxes or collection sites that would take these back. There's also several mail-back programs and special waste pickup services that can be set up in your area. Can you see it now? Okay, perfect. So I'll quickly go over it. The two images on the right are that of sharps containers that you can buy at the pharmacy. And then depending on your community and city guidelines, you should be able to discard them appropriately. For more information specific to your state or your location, you can call the number listed there or email them. Let's take a look at the website for the city of Boston. So this is what the website looks like. On the right, you have some phone numbers and addresses that would be useful. There's also a number that you can call if you see a needle outside. So it's recommended that you don't pick it up with your hands, but actually call this number. And on the left, there are two services that the state recommends that you could use to have your sharps mailed back. Next, like I said, there are two web links on this presentation that show you the FDA drug flush list and the medication kiosk and how to find a medication kiosk. The image at the bottom just shows some sites in the area of Boston where you can take your medications back. To the right is an image of a MedSafe. So a MedSafe is basically a lockbox that's outside of a pharmacy or at a police station, and you can drop off your medications in those. The only thing to remember is that MedSafes do not accept liquids and sharps. All right. So the next section, or the next two slides, talk about two important classes of pain medications that I think are important to know because many of us are using these medications frequently and are unaware of the risks that come with it. The first one is acetaminophen. The brand name commonly known is Tylenol. Ingredients, this is an ingredient in more than 600 prescription medications. And there is a maximum daily dose that's listed for adults and children by the FDA and the manufacturers. What happens sometimes is that we are on two or more medications containing acetaminophen that when you add it all up together exceeds the daily dose limits. In that case, you are subjected to serious long-term side effects that could occur with constant use. So to keep that in mind and to know more about it, there's a really good website that has a lot of information, and it's known as knowyourdose.org. If you go on this website, you can enter all the medications that you are on, and it will tell you whether you're exceeding the dose or not, and also potential side effects. The next link, the next drug class is that of opioids. Opioids are really efficient in managing your pain, but the downside is that they are highly prone to misuse and addiction. More than 100 people every day die of an opioid overdose. That's a really remarkable number, and it's only on the rise. What's also interesting is that this is the first time in history that prescription medications are being abused more than what we call street meds. It's also another reason to note that it's very important to discard any unused and extra medications.
So we were going to show a video, and I think we'll basically talk about this. But you can find this video or any video when it comes to Narcan, which is an opioid antagonist, piggybacking on what Abhi had just spoke about when it comes to opioids. So the potential risks associated with use and how you can be prepared to reverse any accidental overdose is to use Narcan. It's safe. Even if you may think that someone is overdosing and they might not be, and you give Narcan, again, as I can't reiterate this enough, it's safe to give to a patient. Opioid overdose can happen even when taking prescription opioids as directed, and especially at high doses, when your physician is adding perhaps a sedative medication as well. It takes a lot to tip the scale, but again, it can tip the scale. And perhaps maybe, again, your metabolism may be off that day. You may take or you may forget to take a certain medication and you double up. It can cause an event. And in this video, when you do watch it, will help you recognize the signs and the symptoms to take prompt action in saving a life, because again, you're the one when it counts. And it'll walk you through how to administer Narcan, nasal spray, call 911, and also call for assistance. Narcan is available in all chain pharmacies. You might want to contact your independent pharmacy because a lot of them don't carry it, but your chains do. And it's all with a standing order. You can go in, you can ask for it. You don't need to have a prescription from your prescriber. It's ready to use, it's affordable, and if I'm not mistaken, insurance covers it. Most do. So something to have on your person. It's really a very helpful medication if there is ever a crisis.
So moving on to the next section of the talk, we wanted to spend some time talking about medication adherence and how that relates to medication safety. I have a question for you here. Amy, if you're able to open the chat box for everyone. I would really appreciate if you guys could list some of the barriers that you think are present to adherence to medications. What do you think prevents you from taking your medication? The reason this is important and relates to medication safety is because if you don't end up taking the medications as prescribed or not at all the times that it's recommended, it can lead to an error, it can lead to an event, and ultimately cause harm. I see a few answers coming in. I'll give it a few more seconds. Great. So many of the barriers that I see are similar to the ones that I have listed on my end. And to sum it up, one of them could be not being aware, not having enough knowledge about the medications you're taking. It could be language. It could be the way it's written. Sometimes that can be confusing. Cost is another barrier. There's also not the lack of the right resources. So not knowing who to go to or where to go to get the right information. And now that we have a good summary of what the barriers could be, we want to spend the next few slides talking about how we, your pharmacists, can help you.
So it's all step-by-step planning, something that we've been discussing. And so we have some tools for you. We have a medication reconciliation chart, pill cards, brown bags, and also pill boxes as well. They're all at your disposal. And as pharmacists, it's good to take and plan with your pharmacist when you can sit down, sit together and review your medication history on the medications you're on. There's a website that's there that you can print out this medication reconciliation. It's just a template. And it helps patients when to take their medication, morning, afternoon, evening, with food, without food. You know, should it be stored in the refrigerator? Injectables as well. Again, we're experts in the field. We have over 6 years of professional pharmacy study plus licensure. And who better than us to help when it comes to medication reconciliation and helping you? As Abby said earlier, we love questions. And again, it's good to plan with your pharmacist a time when you can sit together and really go over all of this. You'd be surprised, a lot of people do come in with a brown bag of their medications. We do find a lot of interactions. One of the tools that we use here at Mass General Outpatient Pharmacy is called Meducation. And it's a unique tool, and it helps patients stay adherent to their medications. It can print instructions of more than 20 different languages. And it also has a detailed calendar that we provide to you when you're taking your medications. I can't say enough, it's a very intuitive, patient-specific tool that helps you stay regimented when it comes to your medication adherence.
We'll say it again. Counseling. Like I said in the beginning of the talk, it's a very simple step that you can take whenever you're at the pharmacy next. Come talk to us. And this acronym right there, which I think is very appropriate, sums up everything that we can talk about. D for dosage. So we can talk about when to take the medication, what happens if you miss a dose. Do you double up on it or do you skip it? Results. We can talk about what to expect when you start a new medication. Does it require to be started slowly and then titrated up? Or do you go right into the max dose that the doctor recommends? Underlying issues. This, the way I like to describe it, is more specific to each patient. So we look at your medication history, we look at your past medical history, and come up with any specific side effects that you should expect that may occur. Any special drop box warnings or black box warnings that are associated with the drug. And lastly, G for general information. We can talk about storage, safety tips, any refills. When do you come in next to pick up your medications? And if there are any mailing options that are available to you. Next, medication adherence apps. This is something that you can do on your own as well. And it's a great tool to help remember whether or not you took your medication. You could download many of the free apps that are available on both platforms on a smartphone. And these will send you reminders every time it's time to take your medication. You can add new medications, take some off that you're not on anymore. And the other interesting feature is that you can log each time you take the medication. So it develops a medical history or a medication adherence history for you that you can discuss with your provider the next time you go there. The bedside delivery program is a program that we deliver at the Mass General Outpatient Pharmacy. And this is essentially at the time of discharge. Now, discharge can be really a very stressful time. The patients are given a lot of information. There's a lot of paperwork that needs to be done, and it gets overwhelming. By this program, what we can do is we can bring up your discharge medications up to you, to your room, thereby eliminating the need to stand in line to pick them up. This not only ensures that you go home with your medications on time, but it gives us an opportunity to discuss with you each medication and its uses. Mensing is another program that we offer at the MGH outpatient pharmacy. It's essentially your prescriptions matched to your schedule. With this program, you can sync up all your medications to be picked up at the same time each month or every 3 months. This way you ensure that you get all your medications at the same time. And then you also get reminders every time your medication is ready to be picked up. You can call us to be enrolled in this program or come in person and have us enroll you in it. So this brings us to the end of the talk, the how. So I just have a few tools right here for you to take home with you. The top 2 numbers are numbers to poison control. I think it's very important to have them saved on your phone as soon as you can and call them anytime there's a medication related issue. The link in the middle is to a form. It's a form that helps you report the medication related error that occurred. This helps everyone else, it helps others to be wary of that medication error. It helps build a database that can be used in the future by manufacturers to avoid and provide information on the errors that happen. And lastly, your team, your provider and your pharmacist. Always keep us in the loop. We are here to ensure that you become the leader of your medication management.
So we end with this thought and this quote. Safety is something that happens between your ears, not something you hold in your hands. Remember, it's how we express ourselves, how we communicate with our providers, your team of health professionals, and how we all listen. Abhi and I would like to thank you all for attending, and giving us the opportunity to be with you today. And we welcome any questions that you may have for us regarding your medication safety.
Thank you so much for an insightful, engaging session. So we are now towards the end of the presentation. If you have any questions, feel free to enter them in the chat box. So there is a question about earlier in your presentation. You had mentioned black box warning. What does that mean?
That's a really good question, and thank you for asking that. A black box warning is a warning that's put out by the manufacturers based on the data that's collected and submitted that shows that there's a very high risk associated for special patient groups with that medication. So it's not a risk that may be faced by everyone who takes the medication, but very specifically for populations that they've found to have a high risk for that. And it sounds really scary. It's like a black box and it's right there, but it's hard. It's easy to miss sometimes, and just something to be aware of when you're on the medication.
Mm-hmm.
And we as pharmacists would let you know, and as many times we'll let providers know as well.
And there's a question about speaking with a pharmacist. So it sounds like you're encouraging a conversation with pharmacists about their medications. Is an appointment generally needed to consult with the pharmacist, especially if it's going to be a conversation that will take more than a few minutes?
Can I take that?
Yeah.
No, not necessarily. It depends upon, I mean, when you go to your community settings, you do see how busy they are. But it is part of what we are to do. It's an oath that we took, and it's part of our job to ensure that our patients are well cared for. When you're leaving the pharmacy, you'll hear your technicians, you'll hear your interns, who's ever waiting on you, to ask, do you have any questions for the pharmacist? That's a state and a federal law. And it's important that if you do have a question, the pharmacist will have the time and will make the time to talk to you. But if you want something more in depth, if you truly want to go over your medications thoroughly, then it's always good practice to set a time with the pharmacist.
Is a number generally provided if they have any questions after they pick up their prescription that they can call if they have questions about their medication?
Yes, I know at MGH we do, and I'm almost certain that at any pharmacy when you pick up your medications, there should be a number right on the label of the bottle or the medication that you pick up, or in the paperwork that's provided to you. There's usually a number on it. If not, again, something to ask. Just let us know and we'll give you a special business card that has our number on it, and then you can call us.
Great. And then we have a question about medication interactions. If a person takes multiple medications, it can be overwhelming. What's the best way to prevent and to be knowledgeable of any potential medication interaction?
Well, that's a good time when the pharmacist are reviewing your medications, or your provider at that time. They're reviewing all of your medications. That goes under that, recall that reviewing slide that we went over. You know, sometimes it's good to, it depends upon the medication. If there is an interaction, the pharmacist and the provider will inform the patient, okay, this is a good time to take it. I'll give you an example. Some patients who are on Synthroid, also known as levothyroxine for their thyroid. It's best to take that medication in the morning, but you want to take it an hour before you eat or 2 to 3 hours after your meals. Now, there might be some other medication that you need to take in the morning as well. So if that's the case, then you want to plan your medication regimen in like 2 hours after you take your, say, your Synthroid. But it's always good to know, and that's where we can also come in and help plan. Do that medication reconciliation, do a pill box, do a pill chart for you.
Is there a website available to the public on looking up potential drug interactions?
There are websites, there are databases that are available to us and to public as well, but most of the ones that we recommend are paid. So you need a paid subscription to access those websites.
Mm-hmm.
I would refrain from using google.com to find answers to interactions, and instead just give us a call again, or give your provider a call, because we have access to those databases. We can enter in all the medications that you're on, and see if any interactions pop up.
And one thing, if I can add to that as well, is that pharmacists, you may go to a particular pharmacy, but that doesn't mean that if you're out of state or out of country, that you can't discuss your perhaps questions with another pharmacist who may not know you. Again, that is how you want to communicate with the particular medications that you're on. But a pharmacist is always available 24/7.
It's reassuring. So we're going to give it about another minute or so to see if anyone else has any other questions for you. In the meantime, do you have any final thoughts you'd like to share with the audience?
I just want to reiterate that it's important to remember that you are the leader. We are here to support your journey to medication safety. So take that charge, ask questions, and get it sorted. Don't wait for us to find out if there's something wrong with your medication.
I agree. I mean, be that active participant, as I mentioned, you're in the driver's seat. You're in control of your healthcare, and it all starts with you. And with that sound base of questioning, I will tell you that your pharmacist and your provider will say, whoa, this person is in charge of who they are, where they want to go, and they care about their health. And the beauty about it is that, as I mentioned a moment ago, pharmacists are always available. So don't ever feel you're alone. We're always here. And that old adage, there's no question that's ridiculous. We need to know. So be that person.
Thank you, Petrece. Thank you, Abby. It looks like you have provided a variety of resources in your presentation. If you're interested in viewing the recording of today's session and to check out the resources that they shared, It'll be posted on the Blum Center website. I would give about a couple of weeks, but it'll be there. You can visit our Blum Center website at massgeneral.org/Blum-Center. And if you want, links to any particular one, feel free to email the Blum Center. We are at pflc@partners.org, and we can gladly share the links that we're providing today's presentation. All right. Thank you so much, Abby, Petrece, for today's presentation. It's very helpful. Thank you, everyone, for joining us today, and have a lovely rest of the day.
You as well.
As well.
So long, everyone.